In this lesson, we're going to take a look at a brief overview of CPR. Let's talk about CPR. It's crazy, it's fast, it's confusing. Some people hate it, some people love it. But the thing you need to know is that you need to be prepared to jump in and do whatever you can to save your patient's life. And that's the goal, is we want to give you the basics of CPR. And when we look at CPR, the first thing we're going to want to do is identify a need for CPR. You need to assess your patient first, and you need to make sure that your patient actually needs CPR. And the way we do this is to make sure they're not just asleep. So you walk in, if your patient, you shake your patient, hey, are you awake? If you don't get a response, then do something that you can to try to wake them up. You can do these things like sternal rubs. So you can rub their sternum. I've pinched the inside of arms before, slapped the bottom of their feet. And what I'm doing is I'm trying to use any sort of stimulus to try to wake them up. And when you do that, if they don't wake up, then the next thing you're going to need to do is check a pulse. You need to reach down and see if that patient has a pulse. You can, there's two places that you typically will check. One's like the radial artery in the wrist, and the other one's a carotid. I will often check both. Sometimes I'll get like a real weak or thready pulse in the radial, or I'll get it weak in the carotid. But if I don't have a pulse, I know that that's going to tell me that I need to do my next steps in CPR. The one thing that I want to point out here is that we need to know and ask about neck injuries. Some patients have unstable spines, especially in trauma. So you need to make sure that you're not actually ever going to tilt the patient's head back. One time I had a patient, he had like a C2, C3 unstable spine, and they ended up taking him to the operating room, and he started to lose his airway. And what ended up happening was they removed the C-collar and they tilted his neck back, and it actually severed his spinal cord. And when they did that, he actually became a quadriplegic. It was really sad, very unfortunate. But the thing is this is why we never actually tilt the patient's head. We actually use something called a jaw thrust. And you'll know this through your BLS or your ACLS training, is to make sure that when you're putting your patient's face in a way that you can actually pass air through the CPR process, that you're not actually tilting their head back. But the thing that you need to know is you need to ask about any sort of neck injuries. Hey, is this patient's cervical spine unstable? We need to check. If they have a C-collar on, then you'll know. But the thing that you guys need to focus on is that you need to focus on using a jaw thrust instead. If you can't feel a pulse and your patient won't wake up, you better get somebody's attention. So Nicole will often tell her the nursing students and anybody we've ever talked to, hey, you have to use something called it's called the Help Me voice. And what it is it's like a tone or a volume that you have that's, hey, this is something that's different. I need help in here. It's not, I need help. No, help me. I need somebody in here. Do something like, I've kicked chairs out of rooms. You can hit the call light. You can start yelling, hey, bring me the crash cart. You're going to get somebody's attention because you're going to need help. You're going to need, like, you can't leave your patient's bedside, so you need to make sure that you're getting help. The next thing you're going to do is drop the head of the bed. There's usually a lever or a trigger or handle. Drop the head of the bed, and you want to start doing chest compressions. That's going to be your first thing that you're going to do. You're going to focus on 100 to 120 beats per minute. This is right about at 100 or compressions a minute. But what you want to do is you want to focus kind of in this window. You don't want to go to like 180. That's too fast. It actually prevents something called chest recoil, which is allowing the entire chest to come all the way back up. So if you're going too fast, you're not going to be able to do that. So what you'll need to do is focus on doing 100 to 120. You want to get full recoil when you're doing chest compressions. Also, don't delay your chest compressions. You want to get going just as fast as possible. Also, one other tip, you actually want to, if you can get a backboard and slide that thing underneath your patient at your earliest opportunity, it keeps the bed from kind of squishing in, and it'll give you a good solid base to do your chest compressions on. You also want to make sure that you never stop compressions unless you're instructed to by a doctor. For instance, if they call the code or they say, hey, we don't want to do this anymore, or a family comes in and says, hey, we want to stop doing the code, or, we don't want to put my mother through this, then that's one instance you would say, but you need your doctor to, or your provider, whoever is running the code, to say, hey, this is what the family wants. This is what the DNR is. This is what the advanced directives say. We need to make sure that we're following those instructions. Remember to go hard and fast, and you want to also allow a full recoil. Oh, and one other important tip is switching. When you switch, like let's say you're doing your compressions and you're going, you're giving your 100 to 120 beats per minute, and then all of a sudden you're like, hey, I'm getting really tired. What you want to do is you want to time this. You want to time this switching out. So you'll be like, hey, can you take over for me? I'm getting really tired. And what you'll do is you'll say, okay, on 4, and you do 1, 2, 3, 4, and then the other person will jump right in, usually from the other side. So that way there's no delay in giving compressions. And when additional help arrives, there's always going to be a provider that's going to place an open airway. This is your ambu bag, and this is what you're going to be using to give rescue breaths if they don't have an advanced airway with this mask. But what's going to have to happen is your patient's probably going to need some sort of advanced airway to continue breathing so that they can be hooked up to maybe a mechanical ventilator. Sorry, I spelled that wrong. Vent. But what you're going to want to do is you're going to want to give the provider the opportunity. So you're going to want to use your ambu bag to give those rescue breaths. But then you're going to have a 10-second window for that provider to come in and to place that airway. And this is kind of a general rule. Most providers know that they're not going to be that they're not going to get 3 or 4 or 5 opportunities to do this. They're going to get 10 seconds. They're going to say, hey, I need to place the airway. They'll do whatever they need to, but they got one shot. And that 10 seconds goes by, and if they don't have it, you got to keep time in your head. And if they don't have it, hey, I'm sorry, I got to continue compressions. It's been 10 seconds. And start doing those compressions. People are going to have your back on this. Be assertive. Make sure that, because the thing is your patient's not getting any perfusion because you have this 10-second delay because they're trying to place this airway. The advanced airway does no good if the patient's not circulating blood. So that's why they had this 10-second window. Also, your other healthcare providers, so your RNs, any NPs or whatever, they're going to come in and they're going to be placing lines around you. They're going to come in and they're going to place your additional IV lines. They may put in a Foley. They may do all these other things, and especially the AED pads. Don't ever stop, or your defibrillator pads. Defibrillator. Never stop your compressions to allow them to place them. They will work around you. Just keep those compressions going. That is your goal. So you want to focus on doing these compressions. You want to keep doing those compressions until you have some other instruction. Also, make sure you're using the appropriate AED pads. And when I say appropriate, I mean it's the right size. So what you never want to do is have an adult that needs CPR, and you grab the pediatric pads. That's not going to work because it's not going to deliver the right size shock when they need to. So what you're going to want to do is make sure that those pads are appropriate. You can, in very, very rare instances, use adult pads on peds, but the thing that you want to remember is if you have pediatric patient, use your pediatric pads. If you've got an adult patient, use your adult pads. So another thing we want to talk about are these things called 2-minute cycles. So what's going to happen is you're going to have this 2-minute cycle of compressions, and it's going to be 30 compressions to 2 breaths. So your compressions, and you're going to have your breaths. And you're going to do this. You're going to continue 30 compressions, 2 breaths, 30 compressions, 2 breaths. And you're going to do this for 2 minutes. You want to make sure that somebody is timing this. The Philips monitors in the hospital, they've got, your lines up here, and then you've got your blood pressure over here. There's a little timer over here in this window. It's called a code timer. What you can do is this is an opportunity for you to reach up. The Philips monitor is not in every hospital, but it's very, very common. And most hospitals have some sort of, one of these units, but if you reach up here, it's a neat little trick. You can actually hit that code timer and you can know how long your code's going, especially if you don't have anybody in there. Provider comes in, how long has it been like this? So you can look up and say, hey, it's been 3 minutes. We've already done 1 cycle. We're on our 2nd cycle. But the thing you want to remember here is everything's on a 2-minute cycle. You're going to do these compressions. At the end of the 2-minute cycle, you're going to start this guy over. This is where you can switch out people that are doing compressions, switch out people that are doing breaths. This is going to be your opportunity. But the thing is whenever at the end of the 2-minute cycle, you're going to check a rhythm, check a pulse. So you get 10 seconds to do that. So you're going to do your 30 to 2. You're going to do this for 2 minutes, check a rhythm, check a pulse. Also, another thing here is one person is checking a rhythm. And then the other one is checking a pulse. What you don't want to do is do this thing where you're like, oh, I'm going to spend 10 seconds doing this, and then I'm going to spend 10 seconds doing this. No, you get one person to do one thing, you get another person to do one thing, so you only have a 10 seconds time that's been elapsed, and then you go right back to doing your compressions. because that's what's important is you want to keep this going. So keep those compressions going. You've got your 2-minute cycle. At the end of that 2-minute cycle, switch your providers out so that everybody maintains that they can still continue to give those good quality compressions. Once that's done, then everybody switches out. When we're talking about shocking a patient, you want to do those compressions until you're ready to shock. What you're going to do is compressions. You're going to keep doing it. And then at some point, you'll get your 10 seconds. Check a rhythm, check a pulse. This AED, if you're using an AED, will analyze the rhythm. So there's some rhythms that are shockable, some rhythms that aren't. But with this, the AED will check it, and then they're going to say, okay, shock advised. So what you do now is you clear your patient. You want to make sure that nobody is touching the patient so that nobody else gets shocked. So the way we do this is what I usually say is I'm clear, you're clear, everybody's clear, and you do it what's called a sweep, where you look around and see if anybody's actually touching the patient. If they are, slap their hand away, say you're going to get shocked, move them out of the way, and then deliver the shock. The other thing too is you want to be loud, make sure everybody can hear you. I'm clear, you're clear, everybody's clear, and then go. And then once that shock is delivered, guess what you're going to start doing? You're going to resume these compressions. You're going to keep that going. So what do you do if a shock is not advised? Well, you're still going to continue your compressions breaths. You're going to do your 2-minute cycles. You're going to do your 30 to 2. You're going to get to the end. You're going to check a rhythm, check a pulse. No shock is advised, and get back on this guy. You're going to keep continuing to do your compressions and your breaths. You want to continue to make sure that you're delivering those high quality compressions. At the end of those 2-minute cycles, again, switch out with your provider so that you continue to give those high quality compressions. Doesn't help anybody if you're like giving half effort compressions because you're so tired. But again, that's what you want to do. You also will, at some point, your healthcare provider, so your NP, your PA, your doctor, whoever's going to be running your code, and your ACLS certified providers are going to come in, and then they'll use things like pharmacologic agents, so epi, amio, and they'll be able to try to restart their heart, maybe chemically, and so sometimes that helps. But this is what your responsibility is. You want to continue this 30 to 2. You want to continue your high quality compressions. You want to make sure your patient's hooked up to the defibrillator or the AED, and you want to keep this going. And then when the ACLS or the other healthcare provider comes in and they're going to start their ACLS algorithm, that's when you'll be kind of given relief. But for the most part, keep those compressions going. There are a couple of rhythms where you wouldn't actually shock a patient. So what you would actually, you still want to continue to give those compressions and breaths. Nursing concepts for this lesson are about clinical judgment because we want to make sure that you know how to do your CPR. You also want to focus on perfusion and your oxygenation. So this is really about compressions. You want to keep those compressions going because you want to keep the tissues and the organs perfused. And your patient can't do it without your help. So let's recap. First, you want to identify that your patient actually needs CPR. You want to try to wake your patient up, check a pulse. You want to do whatever you can. I have no pulse. But again, you don't want to wait any longer than 10 seconds because then you're actually, your patient's not getting any blood to the vital organs. If you don't have a pulse, you want to yell for help. Use that help me voice. Kick chairs out of rooms, start yelling, get somebody in there to help you, drop the head of the bed and start doing your compressions. You want to go 100 to 120 beats per minute. Quick tip. The one that we often use is called Stay Alive by the Bee Gees. If you have not heard this song, listen to it. I'm sorry, it will annoy you, but you will never, ever forget what 100 to 120 beats per minute, because that song is actually, I think, at about 120 beats per minute. So if you're going on every beat, you're going to continue to give those solid the right rhythm. So here, 30 to 2, we want to make sure we stay on the 2-minute cycles. You want to give 30 compressions to every 2 breaths. You want to watch for chest rise. You want to get full recoil. So make sure that you are getting that full rise out of that chest before you start another compression. And then hook your patient up to the AED. Make sure that they're, let other people do it. Don't stop what you're doing with your compressions to make sure that your patient's actually hooked up. A quick tip for those nursing students: if you are presented with the opportunity, get in there and you see a code, that's going to be your best opportunity to learn how to do this. Get in there and say, hey, I want to do compressions, and somebody will help you do that. You really can't go wrong. The worst thing that's going to happen is they're going to kick you out. But if you're just standing around watching the code, the room gets too full. But hey, volunteer. As a nursing student, get in there and volunteer. Say, hey, I want to do compressions. I want to help this patient. I want to see what this is like. So, and that's going to be your best opportunity, because then that also gives other nurses the opportunity to guide you. Hey, slow down. Hey, you're going too fast. Hey, you need to give better quality compressions, but that'll be your opportunity. That's it for our CPR overview. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.